Welcome to H&HN Daily. I'm Susanna Hopsolin, Senior Editor for Hospitals and Health Networks magazine. According to the U.S. National Library of Medicine, National Institutes of Health, approximately 50% of patients do not take their medications as prescribed. Patients with congestive heart failure are often on many drugs, so the likelihood of drug interactions increases, and so do readmissions to the hospital. Baptist Health South Florida launched a pilot program to provide medication therapy management for these patients at home under the direction of an e-pharmacist. Today, I'm joined by Armando Romero, Corporate Director of Information Technology at Baptist Health South Florida in South Miami, to discuss Take Your Meds. Welcome, Armando. Thanks for joining me today.
Thank you, Suzanne. It's a pleasure being here.
The telehealth program connects the patient with the home health nurse, the e-pharmacist, and when needed, the physician. Can you describe for us a typical visit and how the technology comes into play?
Yes, so a typical visit involves the home health nurse going out to the patient's home. They're equipped with portable devices, either laptops or iPads or some type of portable device that communicates with the organization. They bring a hotspot. They're equipped with a hotspot or with some type of cellular service and are able to communicate using high definition with our main center where their e-pharmacist resides, and therefore they're able to have that dialogue on a real-time basis.
And how is the e-pharmacist interacting?
Whenever they have a call coming in from a home health nurse, they will get a notification and they will be able to open up, just like if you're having a conversation on the phone and then you get another phone call coming in, you're able to switch to that other phone call, in this case to the other video conference, and then they're able to have that dialogue with the home health nurse.
Is the patient also talking to the pharmacist?
Most importantly, they're able to speak with the patient. They're able to introduce themselves to the patient, explain a little bit about the connectivity, ensuring them that it's a secure connection, and they're able to then take a look at the patient, ask questions, take a look if they have any wounds or anything specific that is important for the e-pharmacist to look at. They're able to see those, and then they're able to compare what type of medications they have been prescribed, how are they taking those medications, has there been any improvements in the wounds, if there's a wound, or in the health of the patient, and then they're able to go back and make any necessary adjustments if that is necessary.
In this pilot program, a lot of the patients really required an intervention. As a matter of fact, all the patients required an intervention by the pharmacist, and it was on average 5 interventions. Did this surprise the clinical team? What did they learn about this group of patients from this pilot?
It certainly emphasized that there is a need for review of medications. Now, and not only the review of medications, it's also the review of how the patient is administering those medications themselves. We have found that there were some instances where some of the patients were unable to afford the medications. And therefore, our e-pharmacists went back and looked at some alternative medications that were as effective, but at a much lower cost. In addition to that, they were able to identify some areas where there could have been some type of conflict between multiple medications. Again, this patient population is very, is highly utilizes different types of medications, and therefore, the fact that there could be a conflict is always a possibility, although unlikely, because we have a lot of measures to prevent that. But the e-pharmacist is able to come back and is able to make a personal review of all those medications and see where there could be some type of medications that perhaps could better improve outcomes.
So in addition to better patient outcomes with the medications, you also saw a dramatic drop in your readmission rates. It was down to 11.6 for this patient population. The national average is 24%. What kind of cost savings to the system can you see from implementing this type of a program?
There were some definite cost savings associated with the lack of readmissions for these 17 patients. We look at a national system that provides some type of feedback on that, and the amounts were around $35,000 for the 17 patients. However, it's really dependent on the type of readmission that occurs. Obviously, there could be chances where the readmission costs are going to far exceed those amounts.
Congratulations on your Innovator Award, and thanks for joining us today.
Thank you very much. It's been my pleasure.